Hi everyone, my name is Angelica. I'm a registered nurse at Westchester Medical Center. I've been a nurse for approximately 1 year this September. I work on Med-Surg. In my opinion, Med-Surg gets a bad rap for its complexity of patient and the workload that we experience. Um, Patient acuity range from acute medical problems, behavioral health, to post-surgical recovery. On some occasions, the patient workload is over five, but fortunately, we are 5 to 1 on a for the most part because we are staffed. Um, Despite the challenges that I experience in Med-Surg, I truly love it. The time goes by so fast. Next thing you know, it's end of shift and it's time to give report, and you're like, where did the time go? Which is amazing. Um, I also realize that on Med-Surg that no two patients are the same. I find opportunities on every assignment to apply my critical thinking, nursing judgment. Um, I'm also able to double check the providers, the residents at the hospital to make sure that their recommendations for this patient is still applicable for their plan of care. Sometimes the patients change, their status changes, so it's time to change the regimen based on my nursing recommendation. Um, I recently graduated from Excelsior University through their LPN RN program. I had a great experience over there. I was able to do my classes online, work full time. I did my clinicals in person at the hospitals near Albany. It was difficult, but it was definitely worth the sweat and tears. So, because here I am. I chose to go back to school for my BSN for a couple reasons. Mainly because I want to work in a hospital setting, which I am, thankfully. But when I graduated with my ADN, I was only able to apply to 2 hospitals near me. The rest of the hospitals were requiring BSN only, so it definitely limited my opportunities to explore other hospitals that could have been paying more where I work now. So even though it limited my opportunities, I'm definitely grateful where I work. I love it. I mean, I can't change. I won't change it for a different hospital at this point. Um, Being that I do know that our uh, nurse to patient ratio is pretty good, 5 on Med-Surg. So I wouldn't change that. But I did hear previously, where I currently work, that the hospital did only accept nurses with BSN, but due to COVID and the nursing shortage, they opened the positions to holders with the ADN. So now that COVID is now 6 years past, I'm pretty sure that we will be moving towards BSN only, especially since I do see positive changes in the hospital, um, where it seems like we're steering towards magnet status, which is great because that's the certification that many hospitals want. Patients love it, and it's also good for the quality of patient care that is given to the patients. Um, I also find that since I started the program at U Buffalo, I noticed an emphasis on leadership, research, and health promotion, informatics, and the like, um, which is different from outside of the clinical skills that was emphasized in the RN program, right? But I do find that this curriculum, or just any BSN curriculum rather, not just at UB, encourages nurses to learn how to become more autonomous in their career, be able to promote higher quality of care and safety to patients through research, the use of evidence-based practice, and using leadership skills to advocate for patients and the nursing profession, which I think is phenomenal. I don't really have much of a plan for myself 5 years from now. This was a common question when I was interviewed for my RN position, and I still hold the response to this day when I gave this answer. I'm not sure where I see myself in 5 years. I choose to keep the journey open to any and all possible opportunities that may come my way, whether it may be me remaining as a staff nurse, becoming a charge nurse, taking a role in as a clinical educator, becoming a nurse practitioner, or even becoming a chief nurse executive. That's fancy. The career paths are endless. As for my immediate goals, though, I do know within the next 12 months, I do want to become certified for my unit at Med-Surg. I also want to become an active union member at my hospital. And I plan on doing this by taking their seminars or courses that they offer. They offer it in person, through Zoom. So I want to take advantage of that. And it's more for my knowledge. It's mainly for my knowledge why I want to do that, but also be able to advocate for my colleagues, for the profession, and for future nurses, and also for the patients. This is all of what the union does, at least in my hospital, is yes, you're doing it for yourself to protect your license, but it's also in order for me as a nurse to give the right care to the patient at the right time, with the right resources, so that they can have a positive outcome. And I also want to take courses on leadership. I do want to improve my skills and communication with among my colleagues and other interdisciplinary care teams in the hospital. I feel that communication is needed everywhere. You can't avoid it. I mean, that's the whole purpose of speaking. So I do want to improve on that. It's just more for me. And aside from work and school, I have recently uninstalled my social media applications from my cell phone. So I'm already 1 month in of no apps, which is great. The first few weeks were difficult. I went through a turmoil of emotions and boredom, like a psychological withdrawal that was really difficult and really real. As people, I feel like some of my friends kind of like tease me that I went through this withdrawal, but I really did, because like I was angry, but not anymore. So, but since the storm is over, I have to say that I do feel more connected to my surroundings, to my family, my friends, my partners, and I noticed that because like I make more phone calls, I reach out to my friends. I'm no longer just like texting. I try to make plans to go out. Like I'm trying to find activities to do outside of the screen. So that's a big difference that I've noticed on since I've gotten off the social medias, which I'm kind of really happy. And I also have rediscovered some past hobbies that I used to do when I was younger, such as like painting, drawing, appreciating nature and wildlife, and just finding new things to do. Like now, I'm trying to take the hobby of doing my own nails just for fun. Um, yeah, that's it. So it was a pleasure meeting everyone. Hope this movie wasn't too long. Bye.